Alright, so what's up? Let's play a game called Update Your Channel, because it's been, what, 4 months since I did anything? I think 6. I think it's been a while. It has. I get it. But I haven't, in my defense, I haven't done anything exciting or out of the ordinary that was worth kind of talking about. I spent a month studying for Step 2, which I guess I can talk about, but, it's stupid. I don't like it. Spent 2 months in the ER, and now I'm back on an OB service. So, let's talk about the ER. Let's talk about my experience there and kind of see what I thought about that. So the ER was actually a ton of fun. I was very leery going into it because I don't do well in surprise situations where people are dying, where people could die. So I was nervous anytime somebody would come in with a stroke, with a heart attack, with COPD or CHF, exactly, all these things that are potentially life-threatening, or every time we would get an ambulance call on the transmitter thing, I would freak out, But luckily, my hospital was small enough that we didn't, I think I saw one stroke. I think it was a stroke. One of them. Nothing else. Nothing else was an emergency. So that was good. I got a lot of fun practice with stitching, suturing people when they're alive and awake, which is extremely more challenging than when they're on my operating table, like in an OB room. That they're sitting there and they're sitting there watching you do everything on their hand. They can feel everything. They're squirming around and they're flinching, and it's just not a happy time. It's really different. It's a really different experience, but I got some pretty cool stuff with that. Mainly just got the real good practice on narrowing your H&P down to 3 or 4 minutes, but really getting all the information you need to come up with a diagnosis and a plan of treatment or action. But the thing about the ER that's really kind of I thought was cool was it's really only there to be an emergency room. Most of the patient history is not, I don't want to say it's not relevant because everything is relevant, but you don't have to dive into this 45-minute long history and physical and figure out every little detail of the patient. You just kind of figure out why they're here, what's going on, what are we emergently worried about. If somebody, fell on their wrist, or is it a fracture, is it a break, is it a sprain, is it a tendon rupture, what do we do? So, but that's really all you're focusing on. You don't have to worry about 150 zillion other things. And pretty much, if it's not an emergency, if it's not life-threatening, or it's not a broken bone or somebody in labor, then you really can just send them home and have them follow up in the outpatient setting. If it is something that could be potentially life-threatening, that's when it becomes an issue, and 14 different consults are in order, and you have to do 100 different tests. But it's cool, but I don't know, it's cool in that way, that I wasn't, worried about every little detail. It was more like, okay, who is in immediate danger? Who can we kind of, put on the back burner, and who can we figure out what's going on? And most of the time, it's nothing. Most of the time, these, people fall on their hands or, get hit and kicked in the shin or something with their kids in soccer practice or whatever. 95% of the time, at least what I saw, everything was completely benign. We had 1 or 2 acute fractures. I got to remove a piercing that was embedded in somebody's body. So it's just pretty cool little things that you got to do. Occasionally we would have to admit somebody upstairs because of dementia or, COPD exacerbation or anything like that. But for the most part, it's pretty cool. And I like that it was all a variety. You never know what's going to walk through your door, which is always fun, but it's, it's nerve-wracking at the same time. And everything that you do, there's an immediate reward. So you don't have to wait 6 weeks to a month to see if what you did paid off. Everything, within an hour or two, these people knew. I mean, you knew if what you did was right. You knew if what you did worked, and you got to see the immediate result of your treatment plan. So that really all was why I liked the ER. And it was very fast-paced, and it was very different. So it kept my attention, and it, kept me moving. However, the ER is going to turn you into one of the most cynical people that you've ever been. You're going to be literally be judging everybody, and it is really, it makes you very cynical, and it makes you very, and it makes you very cold, very fast, because not only do you get, people who come in, potential broken bones, cut their arm open on a rock, or elderly patients who, you know, have COPD or CHF or something that you actually have to worry about. But then you always get the drug seekers, which is insane. Then you always get kids with rashes. Not an emergency. You know, it's been going on for 24 hours. Why don't you call your doctor and make an appointment? Kids with a stuffy nose, kids with a sore throat. You know, you just wonder, what do these people do? Why are you not, you know, why do you not call your doctor? Why are you coming into the emergency room because your kid has a stuffy nose? And why is 3 in the morning the time to bring your kid in for their head rash or their stuffy nose? What were you possibly doing all day that you shouldn't take care of your kid? How is 3 a.m. an acceptable time to get your kid treated for his sore throat? I don't know. That really, you know, you really start to get cynical and you really start to get mean. We really have to treat everybody with, you know, as there could be something wrong, but 90, oh my god, you get a lot of pain, a lot of dental pain, drug seekers, a lot of low back pain. A lot of low back pain people are treated chronically for, so really you just give them a 2 or 3 day dose of some pain meds and you tell them to follow up in the outpatient setting, but really none of it is emergency room worthy. But these kids, all these kids with stuffy noses and sore throats, it's like 3 in the morning. Is this really you're going to do this to me right now? But so it's really easy to get, you know, judgmental and turned off, but you have to, you know, really keep an open mind, I guess, and treat everybody like they actually have a problem. Because again, if it worries them, if it's a problem for them, then it's worth checking out. It's worth going to see a doctor and getting an opinion about why am I so sorry. So that's pretty much all I have to say about the emergency room. It was great because it's short, and it's acute, but it's also, you know, some of the people that walk through that door, you're just like, Jesus Christ. We had one patient who came in, they just had surgery a couple days ago, and they came in with pain, obviously, because they just had some surgery, and, you know, they were looking for more pain medicine. And we're like, well, you just had surgery, you know, we're not going to give you any pain meds because you're being managed by your surgeon and their team. And then their significant other or whatever was there with them chimed in and was like, you know, oh, well, they can't sleep at night. They're up all night crying in pain. I've never seen them in so much pain. And you're like, okay, well, I'm sorry that you're in so much pain. Let me go talk to the doc and see what he wants to do for you guys. And then, you know, you're up there kind of figuring out what's up with the doc. And the nurse comes up to you because they were in the room next to the patient and is telling you that the significant other is discussing with the patient how much they're willing to give them money-wise per pill that they're going to get on the street, and how much they're willing to sell it for, how much they're willing to pay for whatever they get, you know, depending on the drug we dish them. I was like, are you serious? I mean, you're in the ER and we're trying to treat you, and this is the kind of, you're going to talk about it right then and there. And it really, you know, one too many of those drug seekers or one too many of those kids with a stuffy nose at 3 a.m., and you really start to get very cynical about the ER, and it's just really disheartening. More than anything, and it really makes you judge and hate people just that much more, especially in medicine. That's it. Other than that, you know, I'm applying for residency right now, still doing OB. I'm in OB now, again, doing another month of it for funsies, and we'll go from there. You know, I can give my opinion on the match and stuff. I guess we can kind of talk about that process and how nerve-wracking it is, because it's so nerve-wracking. And we'll go from there. Anything else you want to see me talk about, let me know. Follow me on Twitter and Instagram if you want a more everyday, frequent update to what it's like to be a medical student in their 4th year about to apply to residency. Thanks for watching. Talk to you guys later. Bye.